Welcome back to another episode of the Meat Mafia podcast. If this is your first time joining us, we have one goal and one goal only, and that is that you, yes you, listen to this podcast and get at least one valuable piece of information that inspires you to go radically change your health today. If this is your second, third, fourth, or 100th time listening to the Meat Mafia podcast, we are so grateful to have you, and we are so thankful for your continued support. Before we get going, if you would not mind going and following us on all of our platforms, YouTube, Instagram, TikTok, Facebook, and of course, Twitter, we would greatly appreciate it. This just allows us to expand our reach, and your reviews, comments, and feedback give us more and more things to think about and improve the show with. Lastly, this is a user-supported podcast and newsletter, and we would not be able to do what we love doing without your generous support and the support from our sponsors. We take great pride in the relationships that we've built with our sponsors and truly believe that they are the best resources out there for better health. Your support and their support, and you supporting them, means the world to us. If you are enjoying the podcast and getting value out of it, please check us out on the Fountain app below, where you can support us by streaming us sats or sending us support via our Fountain Bitcoin wallet. Without further ado, here is a word from our sponsors. This episode of the podcast is brought to you by the Carnivore Bar. The Carnivore Bar is a veteran-owned, animal-based company focused on bringing you the highest quality pemmican product on the market. Pemmican is an ancient tradition practiced by American indigenous cultures, and it's focused on simple ingredients: beef, tallow, and salt. It's built for grab-and-go snacking, and it's a great sort of travel, hiking, or school lunch snack. And it's really built for those long-lasting days where you can just run on basically no fuel other than just simple fats. It's rich in saturated fats and provides everything you need to sustain long-lasting energy throughout the busy day. In my opinion, this is a product that is an absolute must, so go check it out in the link below. Also, check out our podcast with the founder, Philip Meese. He does an incredible job breaking down the mission and the passion behind the company. And I think if you're interested in animal-based nutrition, Philip will inspire you with his product. This episode of the podcast is also brought to you by Holy Cow Beef. Holy Cow Beef is regeneratively raised, grass-fed, grass-finished beef raised right here in Lubbock, Texas. Regeneratively raised, grass-fed, grass-finished beef is the gold standard of beef, and Ann and Weldon Warren have made it their lives' mission to provide incredibly high-quality beef to their local community and beyond. They have been raising their animals this way for decades. In fact, they were some of the most influential voices for getting grass-fed and grass-finished beef in Whole Foods back when Whole Foods was a startup grocery store. They were influential in setting the AGA standards, which is the American Grass-Fed Association, so you know they are doing things the right way, and on top of all of that, their beef tastes like butter. Grass-fed, grass-finished beef provides a superior omega-3 to omega-6 ratio than your typical beef, or in other words, it causes less inflammation in your body. So you are promoting a high-protein, high-fat diet with this amazingly high-quality beef, and saturated fats are playing their critical role in benefiting your body through supporting hormonal functions and cellular functions. And if you're looking for the highest quality beef, look no further than Holy Cow Beef. Leave your butcher box, that Australian and New Zealand raised meat, in the cart and order from your friends Ann and Weldon Warren over at Holy Cow Beef. I almost forgot the most important part there. Ann and Weldon Warren also accept Bitcoin as payment, so go check them out at their website in the link below, and you can pay in Bitcoin or in cash if you're looking to save your Bitcoin. I don't know about you all, but I am all about rewriting the incentives when it comes to healthcare, and CrowdHealth is doing just that. CrowdHealth is essentially crowdfunding for healthcare with a small HSA component mixed in. Paying through the nose for health insurance you may never use, only to be turned away when you actually need it, is incredibly frustrating. Also, the exorbitant costs of health insurance has so many baked in premiums that when you compare settling your doctor's bills by paying in cash versus using insurance, the cost is astronomical. So crowdfunding allows you to settle your medical bills in cash and then get the funding you need from your group through CrowdHealth. This is a great alternative to health insurance for people who are low risk, healthy people who just want peace of mind knowing that if anything actually did happen, they do have a pool of funds to pull from to cover their medical costs. The best part, my group is saving a portion of the monthly opt-in in Bitcoin, and the rest is in cash. So those savings are going towards actually preserving long-term value for my group through a vehicle like Bitcoin. We are really excited about this concept, and since the business model is predicated on an incentive-based healthcare, it is a great concept. For people with low risk, minimal healthcare costs, it is a no-brainer. Go check them out in the link below and use our promo code MAFIA for a discount on your first 6 months with CrowdHealth. Andy, welcome to the show, man. Pleasure to have you.
Thanks for having me, guys. Appreciate it. Looking forward to it.
Yeah, we're excited to have you on. We know that you and Harry had gotten the opportunity to connect at an Austin Bitcoin event, I think a few weeks ago. So we're excited to have you on the show. And we were saying that we
ate a lot of meat that night, I think.
We did.
You did?
It was appropriate. I think
exactly.
Cattle brought like 2 cows in. So it was a great event.
That's great.
What did you guys have, some ribeyes or what?
Dude, they had a whole platter full of meat. I couldn't even tell you what it was. They just chopped it up and served it to everyone. And everyone was like ravenous at that point. So it was kind of a feeding frenzy.
They were strategic. They told you to get here like at 6 and they didn't serve. They said they were going to serve at 7. They didn't actually serve until 8. So everybody by 8 was like, just give me food. So it was great meat. It could have been terrible and we probably still would have loved it, but it was a lot of stuff that I think people don't normally, eat. And so they were just kind of showing us, how you can make the kind of the junk cuts actually really, really good if you cook them right. So they did an awesome job.
Yeah, there's all these awesome cuts that you just don't even realize exist when you're buying your beef from the grocery store. And that was one of the things that we first noticed from Cole from KNC is he was talking about the Denver cut and just some of these other like gourmet cuts that ranchers and butchers know about, but we really don't know about it. So it's pretty cool just to like expose the public to that.
Dude, Denver steaks, like how have those gotten lost in just like they are the greatest thing on the planet, and nobody has ever heard of them unless you're like totally into meat. And I'm like, that's all we get. My family, that's the only thing we get is the Denver cuts because they're so damn good.
Yeah, and you only really get them if you're ordering in bulk or directly from your farmer. Because if you go to the grocery store, they basically only have like 4 cuts of meat. It's the same 4 cuts that everyone's exposed to. So yeah, it was really cool just to like hear Cole's insight into like the different things you can do with a cow and not to just focus on these prime cuts that everyone's kind of addicted to at this point.
Sure. Yeah, I get those Denver cuts delivered every week. So you can't get them at the HEB or whatever. We're in Texas clearly. So HEB doesn't have them, but we get them delivered, which is awesome.
Yeah, it's basically like a $10 version of a New York strip, which is fantastic. But we were saying, Andy, before we hit record, we're very excited for this episode to learn a little bit more about everything that you're doing and the team at CrowdHealth. Really your take on, I would say, reinventing healthcare. And the reason why it's interesting to us is that we're very focused on improving the health of society from a nutritional perspective, but we just frankly haven't gotten to dig into things from a healthcare perspective. I think there's a lot of things that people don't necessarily understand that go on behind the scenes that I think you guys have really debunked through CrowdHealth and are doing it in a more efficient manner. So, I think we'd just love to start off learning a little bit more about your story and some of your own personal experiences with healthcare that kind of made you start to think about, CrowdHealth being a viable alternative to the current system that's in place.
Yeah, man. Where to start? I think, kind of just a bit about me. I'm actually a Midwest kid, grew up in St. Louis. So, love my St. Louis pork steaks. I know it's, there's a beef, the beef or the meat mafia. Hopefully, pork's okay, but kind of always been a meat eater since I was little. But I had kind of grown up in a lower class family where we kind of had, junk stuff, just stuff that you can make good with barbecue sauce and throw it on the grill, which is fine. But and then kind of went to business school out on the West Coast. Was during kind of the crazy period of Facebook and Google and all those things popping up. And then ended up, moving back to the Midwest to run a healthcare company. And that's where I really started getting into healthcare, where we were taking care of folks with chronic conditions. These people had congestive heart failure and diabetes, and, we're all over 300 pounds. And, we were monitoring them out of the house, out of their homes, and paying attention to all of their vital signs so that they, wouldn't go to the hospital. We would intervene prior to going to the hospital. So, it was a really kind of cool company, but that was my first foray into healthcare. Sold that company back in 2014. And then really moved to Austin, where I got into the food scene and kind of in a strange way. And I haven't talked too much about this, but my wife and I were recently married. We moved to Austin. Wife got pregnant, and we found out during our 12-week ultrasound that our daughter had a fatal condition. And as we kind of did the research, it looked like that this, issue that she had was because of the stuff that we were eating. It was the chemicals in the stuff. It's called anencephaly. But there's been a huge rise in this condition. Primarily because what we think is just what we eat. We're eating stuff that is chemically filled, and so we kind of went on an organic, meat dense diet, and praise God, had two more girls. By the way, our first one lived to be about 10 and a half hours old before she passed away, and then we had two more girls after that who are healthy. And so we just started really thinking about, like, what are we putting into our bodies, because we had kind of just been programmed to think of this stupid food pyramid that the government has been pushing down our throats for the last half century or longer. And so that's how we really got into food. And I actually bought a company and owned a company here in Austin called Farmhouse Delivery, which is basically working with local ranchers, local farmers that produce, non genetically modified, put all the pesticides and stuff, all that. So it's kind of an organic thing. Really got into food there, and so have been, like, since then, just super focused on, like, what we're putting into our bodies and how that impacts, like, our actual health, right? And it's something that too many people think about. So it's a passion of mine.
Well, thanks for sharing that story. I mean, it's incredibly moving to hear the personal journey that you went to eventually start Crowd Health and these other businesses that are clearly born out of this challenging time for you guys. But when you guys were going through that and starting to make these lifestyle changes, did you realize that this was a path forward that we could actually manifest and create on a larger scale through better food for more people, creating better access, and also starting to think about, hey, maybe the healthcare side of things needs to change too?
Yeah, you look at the core root issue of what's going on, and I think what the core root issue is that none of us are actually responsible for the costs associated with our healthcare, right? We can take a high time preference approach, right, and eat whatever we want right now, and it feels really, really good, and we don't have to pay the consequences of that, whether it be physically or monetarily, for 20 or 30 years, right? So the stuff that I'm doing in my 40s is going to have a direct impact on, on what my health is going to be when I'm in my 60s and my 70s. Unfortunately, it's just my health and not my monetary standing, right? Because I think people, if it hits them in the pocketbook, they'll actually start thinking about, like, oh, okay, like, I have to plan for retirement. Like, people understand that because it's hit them in the pocketbook, but they don't have to plan for their health because we as taxpayers pay everything related to their health. And so it's this high time preference approach just to society, I think, generally. And then I think it's an education thing too, right? Like, people are uneducated about the goodness of meat. And we've been kind of psyoped into thinking that we have to have, all these grains and, all the crap on the bottom of the food pyramid, right, to be kind of our sustenance. And it's like, no, like, that's not the way this should be. So I ultimately thought that doing Crowd Health, and we can talk more about exactly what this is, but as a way to pay for your healthcare actually connects those two things much, much closer than having, a third party insurance company or the government or whoever paying for your healthcare. And I think that that can create some behavior change. So that's really kind of what we're trying to do here. And look, obesity is one of the major reasons why our healthcare is the cost of healthcare is so high. I mean, we have twice, the number of obese people per capita as, almost any other, country on the planet. And by the way, those obese people take up twice as much healthcare. So, you have this multiplier effect that you have obese people taking twice as much amount of healthcare, and you're paying twice as much as other countries too. So it's like, it really does have a massive impact on our healthcare system.
Do you have a sense, Andy, of what those financials actually look like around obesity and what that's costing us from a healthcare perspective in the US?
Yeah, so I actually ran the numbers. I couldn't find it out there anywhere, but I ran the numbers, and it looks to me like the increase of obesity from about 18%, which is kind of what it is on average worldwide, to 40%, actually has about a 20% impact on our healthcare costs. So we have $4 trillion healthcare cost in this country. 20% of it's $800 billion. So I think somewhere between $600 billion and $1 trillion of our healthcare costs are directly related to obesity.
When you start adding up those numbers and kind of forecasting it out over a long enough time period, how do we actually continue on the current system without bankrupting our health and just, our society in general? It just seems like that cost is just insurmountable to overcome without taxing like crazy or, some sort of government intervention that will probably lead to more problems down the road.
Yeah, I mean, it's the government is going to continue to print money, which is, we're kind of excited about what's going on in the Bitcoin world too, and so that's how the monetary system flows into this as well. Which I think you're totally right. It's like we cannot go on like this forever. Medicare runs out of money, I think, in like 5 years or 6 years or something like that, right? And so if Medicare is running out of money, it means we just have to print more money to make up for or we have to tax people. And our legislative system is not set up to increase taxes in a substantial way, and that's clearly going to have an impact on our economic viability as a country. And so, yeah, that's why I'm kind of doing this. It's like something has to change, right? Or my 4-year-old, my 6-year-old will not have access to healthcare in the way that we have access to healthcare today, and so something has to change. Or your country's in deep crap.
Yeah. Andy, one of the things that you had mentioned a few minutes earlier is how you had sold a healthcare company and you were treating patients with chronic disease. And I'm just curious, was there a light bulb moment at that period of time where you started realizing that, hey, maybe there's a correlation between chronic disease that these patients are experiencing and then poor diet and lifestyle decisions?
Oh, absolutely. I mean, the company that I ran was one of the first companies in Texas to do a telehealth intervention. We were actually doing video conferencing over dial-up, like crazy, wow. Right? And so this was back in the early 2000s. And so we were talking to people in the Rio Grande Valley in Texas. So for people who are outside of Texas, it's kind of the valley that separates Texas and Mexico. It's kind of down in that southern Texas area, where I think it's something like 40 or 50% of people have diabetes. I mean, it's super high. And so we were walking through this with them, and all these people had A1Cs of 8, 9 or higher, which basically means it's really, really bad. You're starting to lose limbs. You're having organ failure. All these things. So I'll get to the point, but it's like we took their blood sugars and we're capturing them in our database, and we'd go to them and say, hey, listen, will you have you're having 3 tortillas with every day, right? Today, right? And let's look at your blood sugars, right? Let's do 2 next week and do 1 the week after that. And then let us show you the graph of what your blood sugars look like. And they're like, what are you talking about? Tortillas, like I had these since I was a kid. This is a mostly Hispanic population. And we're like, well, they impact your blood sugars. And they're like, no, they're not. They're not sugar. Like I'm not eating sugar. And I was like, no, like your body turns carbohydrates into a sugar, which your insulin then spikes, and that's how your body works. And so they're like, okay, whatever. So we went and did this, and they actually saw their blood sugars come down. by eating less tortillas. And so it finally registered to them, like my tortillas are actually impacting my blood sugars. And so those A1Cs over like a 12-month period went from, I think it was an average of 9 to like 7, which is borderline diabetic. It's diabetic, but it's on the lower end of the diabetes scale, just by having people understand that what they're putting in their body and how it impacts them. Like, this is just education of how your body works.
So back in the early 2000s, you had a telemedicine business, which I would say is very early for the telemedicine.
Super early. Yeah.
Right?
Decade ahead of its time.
Was it clear to you that the incentives at that point in time were not supporting this growth of this industry that could actually pinpoint the problem, help people make the lifestyle changes that they needed to make, and do it in a way that was actually creating real change as opposed to just giving them a pill and sending them on their way? Like, did you notice at that moment in time, like, hey, these incentives are totally backwards. We're not actually here to at scale really help these people make these lifestyle changes?
Yeah, well, the incentives were screwed up in two places. One is on the patient side. There was no incentive for them to really get better, right? Because the thing that you need to do with diabetes, right, is not have carbohydrates. Like, you need to significantly reduce your amount of carbohydrates, but carbohydrates are delicious. Like, we are addicted to them. As I'm sure you guys or some of your listeners know, like, if you wean yourself off of carbohydrates, there is actually a physiological response from your body that's like, I want more carbs. Like, that, that's called the keto flu, right? I mean, we've kind of, most of us who are into, a high protein diet have done that. So, and so people do not, for some reason, we cannot have this low time preference approach, which is, let's give up something now for better health over a long period of time. Those incentives weren't there. And maybe even worse, though, the insurance plans, what I found is they're actually incentivized to have sick patients, because they get paid more on sick patients than they do on non-sick patients, right? There's a whole industry that goes in, analyzes the patients, goes back to the government and says, hey, I need to get paid more for this patient because they have, all of these different, comorbidities. And so they're actually incentivized to have sick patients, which is a total like screwed up scenario where, your insurance plan, who's trying to negotiate on your behalf to get really good rates, is supposed to help you be healthy, actually is incentivized to do the exact opposite of that. So that's the screwed up part of our system.
Equip's unflavored Prime has one single ingredient derived directly from grass-fed beef protein. For purists like ourselves who try to only consume balanced, real sources of nutrition, this protein powder checks all the boxes. Go check them out in the link below and use our promo code in the description to get a discount.
Wow. It's so interesting to hear you say that, because one of the things that Harrison and I did earlier in the year is we both got continuous glucose monitors just to really test our carbohydrate tolerance and just figure out what works for us and what doesn't. I use NutriSense, Harry used Levels. We both had great experiences with it. And I think the cost, it comes out to somewhere between $200, $300 a month.
Yeah.
And we were just saying the data was so valuable for us to kind of like change our eating habits and figure out what's making our blood sugar rise versus what doesn't. And we were just thinking from an insurance carrier's perspective, wouldn't this actually be like an economically beneficial tool to be able to pay for some of these things, just because maybe by using a CGM, it would prevent you to be a little bit healthier and maybe prevent some of these chronic diseases that you were treating at your initial healthcare company. But I don't know if that's maybe competing with the incentives that you just talked about. So I don't know.
Yeah, I mean, I think the question is will people care? Like, you care. I have a CGM Levels. I've been using it as well for a while. And I care, but how do we, instead of paying for some of these things, which we can do, which I'm not saying not paying for these things, but like, how do we get people to care, right? Like, you guys care because you care about your bodies, you care about your health. You want to be able to take care of your kids and your grandkids and all these things when you're 70, 80, and 90, right? Like, you have a low time preference approach to life, but how do you get a high time preference person approach to life who will eat the, pint of ice cream or the gallon of ice cream or whatever, because it feels good now, regardless of the fact that it's going to spike your blood sugars to whatever, 300 and something probably. And that's where it's a challenge, is like, is the continuous glucose monitor in the hands of somebody who doesn't really care, like, is it that valuable, or is it really just an expensive tool that you're not going to use correctly, right? But I absolutely think for people like you and me and Harry, it's like we should pay for them. Somebody should pay for them. And the question is, should that be an insurance plan? Should it be like a Crowd Health, or should it be us individually? That's a debate we can definitely have.
One of the things I think about a lot, and I think you kind of touched on this a little bit, Andy, is like there's this socioeconomic disparity that exists as well, whereas like the lowest quality food is also the cheapest. So people who are, at the lower end of the socioeconomic spectrum really are getting the access to the least nutritional food. And then at the same time, they're worried about paying next month's bills, not, hey, what CGM should I use? So it creates an absolute ceiling on their like underlying health, their ability to move up to the next like socioeconomic tier to create some financial freedom. So it's really like this limiting factor that kind of rests invisibly over, a large majority of people. It just seems
I think
an issue.
It's a really good, I think, conversation to have, because I think one is there's probably a lot of ignorance around this. One is nobody knows what it looks like to live on, a $12 an hour, or many people don't understand what it looks like to live on a $12 an hour job, right? Like, how do you, with a family of 4 or 6 or whatever, like that's a really difficult thing to try to understand. I think the question becomes like, how do you prioritize things in life so that your family's actually getting nutritious foods? And does it have to be, I think there's something to be said. And Slim and Marty talked about this on their podcast, is like, there's something to be said about like, can we have 2 nutritious meals as opposed to 3 crap meals? And is there a cost savings here where you can say that the 2 actually is the same as the 3? We just are prioritizing this different, meaning like, and I think Marty and Slim would actually say it's 1. I don't think that's reasonable with, I have a 4-year-old and a 6-year-old, and trying to get them to eat 1 meal a day, it would be like an absolute disaster, chaos. But it's like, can we have like a super high protein, nutrient dense breakfast so that which eggs and bacon and those types of things, which I have every morning, are not that expensive. Like, these are not expensive, things to eat. And then a nutrient dense dinner, which, I think you can get, beef meats, that are not that expensive. I think, ground beef is not that expensive. And maybe it's not like the ground beef right off of the rancher's, farm, but it is ground beef, and at least start there. But I think you make a really good point. It's like hard for me, who makes way more than $12 an hour, to, rip on somebody who's making $12 an hour and saying you should be eating better. Like, I very, very well known that it's a problem, and it's a problem that's created by our food system currently for a variety of reasons. And you guys know better than I do, but it's like, why are Cheetos, so low cost and delicious? And it's really, that's a really hard thing to get around. So there's empathy here for those folks, and it's a really difficult situation that I think may need a different solution than I currently have, but it definitely needs to be approached in an empathetic way.
Yeah, I think to your point, Andy, exploring things from this this lens of nutrient density is really interesting, because that's probably one of the main pushbacks that you'll hear when you're advocating for a carnivore or an animal-based diet, is just the upfront cost of beef versus from some of these cheaper products that are found in the inner aisle of the grocery store. And I think product is probably the right word to use there to describe it, because it's really not food, right? It's a food-like substance that's just combining corn, wheat, soy, seed oils, refined sugar. And you're kind of just in this constant state of needing to keep dripping the carbs and the sugar, and you see it on the CGM, your blood sugar is just doing this all day long, where it's like, yes, maybe you're paying a few extra dollars per pound of meat, but you're, even with your kids, they might only need to eat 2 to 3 big meals a day, and then they don't feel the need to snack. So like, number one, your metabolic health is way better. And probably if we run the numbers, it might even be cheaper or barely more expensive. I don't want to say what it is one way or another, but like, I had a period when I was going carnivore when I was 24 years old and making, $60,000-$70,000 a year, which is nothing in New York. And I was, just eating ground beef from the grocery store and steaks and things like that. And guess what? Like my metabolic health really improved even just doing that. So it's very interesting to think about it.
There's something here. I don't know if you guys do this or Slim or somebody else. It's like how at a $12 an hour, $25 an hour, and how can I, in a family of, 2, 4, 6, like put together a plan for me that says like, here's actually what I can eat and what it will cost. So that I can actually make the case to people to say, hey, when you go out of the grocery store, look at your basket and is like, do I have crap snacks? Like let's take for every dollar I have of snacks, let's replace it with $1 of meat. And can I actually make it work for a family of 2, 4, and 6 on a $25,000, $50,000, $75,000 diet? I mean, I think it would be a really interesting thought experiment here, because it's easy for people making, way more than that to look down at people and be like, oh, you should do this, without actually thinking about it. Can it actually be done? And if it can't, then that's where I'm like, I think there is a place for some kind of intervention. I don't like government intervention, but there's got to be a place for some kind of organization to step in and say, let us help you do that. Because I think it's just, man, it's so just core to us as a society to be healthy, and our metabolic health to be long lasting. That something's has to be done.
Yeah. And at the end of the day, like what better barometer or metric of a nation's health and prosperity or prosperity is their health. Like that to me is a key indicator of like how a country is doing, or how like a small population is doing. Is, are they healthy? Are they enjoying life? Are they happy? Like, I think those are kind of like key things that bring about innovation and all sorts of positive changes. But if a group of people is just kind of captured in this world of sickness and disease, they can't reach that level of actually contributing, in a really positive and meaningful way.
Yeah, absolutely. And I think the other thing too is like, people need to measure it. Like people need to understand what their metabolic health is. Because I think probably, I don't know what the number is, my guess, and maybe you guys have a different guess, you're like 90%, 95% of the American population has no idea what their kind of metabolic status is, right? Based on numbers. Like, and so I think that would be really healthy for people to understand, like, what is your fasting glucose, levels, or, blood sugar levels, what is your, we can talk about this in a minute, but like cholesterol levels, like those types of things, which I think is kind of a bad number. So I shouldn't have even said it, but like those types of things, like what are they and how do I improve them? People need to understand that. And so that's one of the things at Crowd Health, what we do is like, we try to get everybody to go and do labs, like go and figure out where you stand on your panels. And that's a good kind of jumping point for what you need to do to improve your health.
It's actually such a good point, because I would say that if you ask maybe like the average 40 to 50-year-old middle-aged American male, let's say, I bet you they could probably tell you what they weigh. And there's probably a good amount that could tell you their LDL cholesterol number, because that's pretty much the only metric that their primary care physician is focusing on. But besides that, I don't think most people even know where to start in terms of getting their blood work done, or what marker should they care about, or what's considered good versus societal standards. Like, it's such an interesting point.
Yeah. So, and again, Crowd Health, like one of the cool things for us is I can go get labs. The community will pay for them. They're only $44. So the entire panel, it's metabolic, it's liver, it's kidney, it's urine, it's everything. There's like 10 different tests. It's like $44. And you get that within 24 hours, and then you can actually visit with a doctor, a specialist, who will walk you through every single line on that. We'll spend 45 minutes to an hour saying, hey, here's what it is. Here's what it means. Here's how you need to change it. And it's like, it's such an educational thing. It's like, we're trying to get more and more Crowd Health people to do those things. So they actually understand how their body works, right? If you don't understand how your body works, then it's hard to understand how the Cheetos that you're eating is impacting you. So we're trying to get more and more people, and we're actually working on a project now where you can get those sucked into the app, so you can actually see them in one place and you can track them and things like that for people who are interested. So give people information, and I think that goes a long way.
So when we get into like the origin story of Crowd Health and why you're doing everything that you're doing, wasn't that partially motivated? Didn't one of your daughters have a doctor's appointment?
Yeah.
It was a 15-minute appointment and you got banged for like $8,000 or something
Yeah.
like that?
Yeah. She had recurring ear infections. And so we went to the ear, nose, and throat doctor, and she said, oh yeah, she's got a perforated eardrum, which basically means she's got a hole in the middle of her eardrum. And so we're like, okay, well, let's go get it fixed. And what they do is they stick a little tube in there. So all the fluid in your eardrum, goes out. And so it doesn't, rupture your eardrum, which is what happened to her. Ear, nose, and throat doc was so afraid that it was going to be, long-term hearing loss. He's like, I'm going to delay my vacation by a day to go and do this, like unheard of. Right. And so we're like, oh, thank you. So we went 15 minutes, got it fixed. My daughter and my wife were in the hospital for like 45 minutes total, got the bill. It was $8,000. And then our insurance company said it was medically unnecessary. And so they weren't going to pay for it. And so I had to stroke an $8,000 check to the local hospital. And I was pissed. I was like, man, this is just ain't right. Like, this is one where I knew it was medically necessary because the hole in her ear, resolved itself, and she had no more ear infections. It was medically necessary, folks. It's like, and so, it's like at that point, I was like, we got to do something different here. These health insurance plans are screwing people, and it's just not right. And I was in a position at the point my first company had done well. I was in a position at a point I was like, you know what, I can take a swing at this and give it a shot. So that was why we started Crowd Health, is to allow people to get the tools to operate outside of legacy health insurance.
Could you maybe speak to what you guys are doing on that front in terms of creating this alternative to traditional healthcare or health insurance systems?
Yeah. So for the little stuff, right, it's like for your primary care doc, for even specialist docs, for blood tests, all these like little things, like you can access all of those on the app as a part of your subscription fee. So, and it's free. It's a part of it. You don't pay, and emotional health too. So you can have as many therapy visits as you want. It's just all part of our platform. And then for the big stuff, what we're saying is like, how can people get help paying for the big stuff without having health insurance? We're like, well, there's these crowdfunding sites out there that can do it, but it's like, can we build a crowdfunding system where you have a higher probability that people are actually going to help you? And so that's ultimately what we did. And the mechanics of this is, instead of sending, your premium to a health insurance plan and it's stuck in the black hole of insurance land, we set up an account for you. You put money into the account every month. That money, goes up over a period of time as you keep putting money in. And then if somebody in the community gets hurt, gets an illness, whatever it is, then let's just say I get a $5,000 broken arm. I would pay the first $500 of it, and then I would ask 45 people in the community to give $100 from them to meet their account to my account. And if they say yes, then that money is transferred. If they say no, then I just move on to the next person. But a part of my request for money is they see how many times I've been asked and if I've said yes or no, right? So let's just say that Andy's been asked 10 times and I've said yes every single time. I've been a good member of the community. But if I've been asked 10 times and I've said no 10 times, I've been a crappy member of the community. And so if I'm a crappy member of the community, people will look at that and be like, dude, I'm not helping you. You're not helping anybody else, right? So it's almost like a reputation score, not too dissimilar from like the Uber driver or whatever. Like if I see an Uber driver with a 1 out of 5 stars, it's like, I'm not getting in that car, right? Like, or an eBay seller or whatever that has a 1 out of 5 stars. I'm not supporting that person. And so we've kind of built that internally for us. And so far, I think we're at 12 or 1,300 bills that have been crowdfunded thus far. And every one that has come from a good member has been funded. So it's working really, really well. And like the thing that makes this work is now I can pay for my broken arm in cash as opposed to that doctor having to build a health insurance company. And so that doctor will take a significantly lower rate than if they had to build the insurance company. So for bills above $1,000, we're saving like 72% versus what the health plans pay.
Wow.
It's crazy.
How is that possible?
Yeah, it's just absolutely nuts. A part of this is because, these hospital systems are gouging us. I saw one the other day and it like pissed me off. It was um, the metabolic panel, comprehensive metabolic panel
Mhm.
in the ER. So let's just say outside of the ER, right down the street, it was $5. Okay. So in the ER, guess how much it was?
500.
285. So
Okay.
55 times what it was right down the street. Right. And so we've actually employed like attorneys to go to the hospital and be like, you're price gouging. Like you are price gouging these people, and that's not right. And there's actually a law on the books. It's for the legal nerds, it's UCC 2-305, which basically says if you've not agreed to the price of something prior to having that service provided, you have to negotiate for a fair price after the fact, right?
Mm-hmm.
And so we go in with attorneys and we say, hospitals, like you have to give us a fair price, and 55 times what it costs down the street is not a fair price, right? So to give us what the fair price should be. And at that point, they're like, I don't want to get sued. I don't want to deal with legal. Like, I'm just going to give you guys, what you're asking for, a way better price. And so in those situations, like they went from $255, and I think we got them down to like $7 or something like that, as opposed to $5 down the street. So a 50% increase instead of a 5,000 or whatever percent increase. And so those are the things that we're doing to actually say, like, you can't do this. Like, that's not fair. And we can do this because we don't have a contract with those hospitals, and we're negotiating on behalf of our members. That's how much fluff there is in the healthcare space and how inefficient it is.
How do you kind of decompose that premium? Is it just all costs that the hospital, overhead costs that the hospital has to pay, or is that just money that they're trying to like, I'm assuming a lot of it is profit, but there's got to be extra costs baked in there that they're justifying charging someone $285 for a $5 procedure or blood work.
Yeah. They look at this, they say, look at this big, beautiful, $500 million hospital that we've built. We have to pay for, this hospital. I used to interestingly be in the hospitality industry right after I graduated from UVA. It's like the nicest Ritz-Carlton or Four Seasons or whatever, in the world is like $1,000 a night, or maybe $2,000 a night in today's dollars. You spend the night at a hospital, it's like, $10,000 or $15,000, right? Just to stay in the room. That doesn't include doctors. It doesn't include medications. It doesn't include any of that stuff. It's just like literally sleeping in the bed costs you that much money. And they say, well, we have to pay for this big, huge, building. And so people get so excited about big new hospitals getting built in their communities. Guess who's paying for it? Like, you're paying for that hospital. And that's where I think there's a disconnect there, is people don't understand, because they're not actually writing a check to the hospital, but they're getting paid less by their employer because their employer has to pay for really high healthcare costs. And so it actually is hitting their paycheck. They're not seeing it directly. It's an indirect cost that people just don't understand how that does impact them directly. Just they don't get it.
Totally.
I'm so interested to see with Crowd Health, and not to get too esoteric, just as you continue to gain momentum and gain more customers, what this is going to do for people in terms of being able to pursue professions or their actual passions. And what I mean by that is I have a lot of people that are like extremely miserable in their 9 to 5, and they're very afraid to make the jump away from it because they have some type of a chronic health issue. Like for myself, I had ulcerative colitis, and for a while I was afraid to leave my 9 to 5 to do the Meat Mafia because I'm getting colonoscopies every couple of years. I'm on this medication.
Sure.
And I didn't want to be just left out to dry. So to realize that there's an alternative to that system that's available, and it will still allow me to be covered through this community system, it's just fascinating what that could do long term, in terms of people maybe being able to escape this system and pursue passions or careers that are more in line with what they're meant for.
Sure. Well, a couple things on that. One is your colonoscopies. You probably, if you got them through the health plan, would be $3,500 to $5,000. If you did it through Crowd Health, we're getting them for like $800, $1,200.
Wow.
And so like there's a huge difference there between, again, cash versus what the health plan will pay. So if you think about that, it's $800 every 2 years. It's like not that big of a deal. Like you can figure that out, right? I had a buddy the other day. He's like, man, I really love to do Crowd Health, but I have this medication I'm on and it's $1,000 a month and I just can't. I was like, okay, what medication is it? So I go to my phone, I go to our app, I plus in the medication, and it's like $72 a month versus the health plan is paying $1,000 a month. And I'm like, dude, it's $72 a month. I was like, what are you paying? He's like, well, for me, I'm paying like $500 a month for my healthcare. I was like, well, you pay 175 for us. So 175. And even if you have to pay for your own meds on that thing, it's another, just say $75. We're at 250. You're still saving, $3,000 a year if you come with us. And he's like, holy crap. Like, this is crazy. So, it's one of those things where, people don't understand how much the health plans inflate these prices. The second point on that is the RAND Corporation did a study, I think 2 or 3 years ago, that said there are 4 million people that are currently working for corporations who would do something entrepreneurial if they could figure out an alternative to health insurance. Like, if they didn't, basically they're handcuffed to their employer by health insurance. And I'm like, man, that's un-American. Like, it's like we're only doing our jobs because our companies are giving us health insurance. Like, that sucks. Like, I want people to thrive. And if we're going to spend 8 hours a day or 10 hours a day or however many hours a day we do something, like, I want you to do something that you love to do. And that's health insurance is keeping people from thriving. It's like, man, that breaks me. Cause I'm one of those guys. It's like, I want to show up to work and be fired up about what I'm doing today. And people see them miserable because of health insurance. It's like, sucks.
Yeah. And to reinforce, Andy, what you're saying about point number one and why you're so spot on, I think I was going through United Healthcare, really good benefits. I was paying a couple $100 a month for that. And I still ended up paying $450 out of pocket for my colonoscopy. So like you're saying, it's like through you guys, I'm paying $800 every 2 years, which you could easily come up with. And then you're escaping, a few $100s of what I'm paying through that insurance anyway.
And the community would pay, you would actually be, pay 500 and the community would pick up anything above the $500. And so it's like you're $500 every couple of years. Like, it's not that big of a deal. Mm-hmm. So, and one quick point on that is that one of the big differences, other than, we don't have premiums or things like that you send and never see again, is that we ask you to pay the first $500 of any health event. So if you go into the hospital, it's $500. If you break your arm, it's $500. It's my daughter's ear tubes, it's $500. So there's not these huge deductibles that you have to get through, which I think is really important to point out, because people only think of their monthly premium and forget about these deductibles. I went on healthcare.gov just to see what my family would be in a healthcare.gov plan, which is an Obamacare plan. It was like $1,200 a month. And I think it was I could be wrong. It's either $14,000 or $16,000 deductible, which means that I'm basically paying almost $30,000 before the health plan pays a dime, right? Like, that doesn't make sense for my family. Yeah. I mean, I'm paying for why would I pay for health insurance? It just doesn't make any sense. And if you don't have $14,000 or $16,000 in your bank account and you get hurt and you're responsible for that first $14,000 or $16,000, that's going to put you in a financial situation that you're not going to be able to dig out of. Not a lot of Americans have 14 or 16 grand sitting in their bank accounts for, a broken arm or ear tubes or an ER visit. Like, these plans are putting people into bankruptcy, and that's awful.
Yeah, something my dad says all the time is health insurance is really just wealth insurance. Like, at the end of the day, it's there so you don't have to end up paying that $8,000 check out of pocket and really just crippling you. To Brett's point, it's like those are the type of events that stop someone from going and taking a leap of faith on an entrepreneurial endeavor or a life dream or something like that. So it's kind of this. It's not it's not obvious to a lot of people, but it does have this invisible hand of effect in terms of how we actually live our lives and choose to, go seek out riskier things just because we don't really feel comfortable with, what could happen from like a healthcare cost perspective.
Right.
I'm really curious to hear your feedback on what your existing customers think about Crowd Health, and just like, what has been the feedback that you've gotten from the people who are using it now?
Yeah, man, I think people are fired up about it because they get their freedom back. Their freedom, they can go to whatever doctor they wanted to go to. They, don't have to get their procedures pre-approved. It's really kind of like healthcare freedom that a lot of people really, really love. And I think it's I don't know what your demographic is for the folks that listen to this, but it's, we've got tons of like meat loving libertarian middle 30 kind of folks that have joined us. So our average age is 36. It's about 60% male, 40% female, 60% single, 40% married. And so those are our demographics, and they love the fact that they're not enslaved to health insurance anymore, and feel really good about the probability of them getting their bill paid if something big were to happen. So quick, I get, the long story short of that is people are loving it. You can go to, Twitter or Instagram or whatever, and people are like, this is the awesome, best thing that I've seen in healthcare. So they're really fired up about it.
Nice. Yeah. And to that point, Andy, we've had a couple, more than a couple, actually, some amazing doctors that are really interested in improving the underlying metabolic health of patients. And as a result of that, you touched on this before, a lot of them have these telemedicine practices, right, where they're advising you on different dietary measures, low carb diets, carnivore diets, like Phil Avadia comes to mind, Dr. Brian Lenskis, a few others. But I guess that when someone's going to them through telemedicine, these types of practices, they're not covered by insurance. So I don't know, can Crowd Health cover part of that, or is it still just like an out of pocket thing for these telemedicine, like these decentralized practices?
Yeah. So one of the screwed up things of healthcare is like, doctors have to be licensed in the state in which they're, providing care. And so, any of these are, we give people one wellness visit per year that will fund for them. So that's, pediatric, OBGYN, primary care, and that they for sure can use this as one of their visits. And then if it's actually for like a longer term health issue, like I've got diabetes or whatever, right? Like that's a health issue that's one health event. So you're paying the first $500 of that, and then the crowd will fund the rest of that. So I don't know exactly how this system works, but at least one of those visits per year is covered. And then, if it's a real like health event that they're talking to this doctor about, as opposed to just like, I'm trying to improve my metabolic health, then those would be helped out with as well. It would probably be on a case by case basis, but I love that idea. And one that's like, look, the other cool thing about not being health insurance is we can start doing things that a health insurance plan just don't want to do. Like it's like, if these people are actually improving their metabolic health through seeing some of these doctors, then people should bring it to us and be like, hey, will you fund this for me? Like, this is actually improving health. And it's like, not only will do that, well, can we get other people to join you in doing this? Because this sounds like this is actually something that's going to improve, more and more of our members' health. So it's kind of fun to be able to innovate within healthcare and some of these new types of services that people are offering.
Yeah, 100%. Go ahead, Harry.
I was just going to say, what I love about what you've said, just then and previously, is you're trying to basically condense that distance that we've created from our own personal health to the care that we actually get, or just like, make it so that we are feeling a little bit more of the personal autonomy over our health, so that we are making decisions that are in line with the, like a natural incentive to be healthy, which is a really, I think, important incentive to be pushing forward. It's like we should really care and feel like there is some risk involved with all the decisions we're making when it comes to personal health.
Yeah. Well, and the other thing too is we're getting people who are like, I don't want to screw the community of people, right? I need to make choices that are not screwing the community. And we actually have like a Bitcoin community, which I'm sure a number of your followers are, Bitcoiners.
Yeah, I'm a part of that.
There you go. And so it's like, it's Bitcoiners sharing with each other their healthcare expenses. And so it's like, it's one thing to, it's just nobody wants to screw their community, right? And our Bitcoiners are actually holding a big chunk of their money in Bitcoin. And if they, nobody wants people to sell their Bitcoin, right? And so we're building some of these communities too, where there's an affinity for these folks that I don't want to screw my neighbor, like that's not, there's something just, innate about that. Like, I don't want to screw over my neighbor, if I don't have to. And so I think their behaviors are changing too, which is like the key component here, right? Like, we can build as many systems as we want, but people's behavior has to change. One quick story is we had a member in Tennessee, 19-year-old girl who got her hand caught in a prop of a boat, severed 4 of her fingers. And so we went out to the community, and we were like, it was a big bill, as you can probably imagine. Went out to the community and we said, hey, this is what happened. Will you give to this woman? And we had people come back and be like, not only will I give, I want to give more than what you asked me to give, right? Like, how, in what context in healthcare would people be like, let me give more than you've asked me for? Like, it just doesn't happen in health insurance land, right? We had, a miscarriage a couple of weeks ago, and people were like, I want to help this woman. Like, how do I help her get through this? Because that's got to be a really hard thing. And so I'm connecting community members with each other. So it's not you're sending money into this black hole of the health insurance abyss, right? It's like, I'm helping this woman who had a miscarriage in Illinois, or I'm helping this woman who had, her finger severed in Tennessee. And like, there's a humanity about that I think is really drives some of this, which is really, really cool, I think.
Yeah, I think that's might be the most interesting thing about what you guys have done, is that you've created this like really organic, whether you want to call it skin in the game or community, or even just like, I think about the term of like loving thy neighbor that we've really gotten away from.
Totally.
Right. And if I'm opting into Crowd Health, it's like, well, if something happens to Harry, of course, I'm going to opt in for that. And I also hope selfishly, too, that if something happens to me, that Harry or you would be willing to pay for me as well. And it's like, I know that if I'm not willing to help out the community, why should the community scratch my back then if I'm not willing to do that for anyone?
Totally. And I think one of the challenges we have in our society generally is like, and this happened in the 1970s, primarily with like money and healthcare. It's like the government has come in and said, hey, I'm going to disconnect you from people in your community. I'll take care of them as the government, so you don't have to take care of them. And so it's like this sense of generosity and humanity and just love of thy neighbor and responsibility for your neighbor has been taken away from us in many ways, because, look, back in the day, if somebody in your community got hurt or injured, right, the community would gather around them and help them. Like, hey, the guy can't go plow his field because he got hurt. Like, let's the community and go and help him plow his field, right? And we just don't do that anymore, because it's all these government programs that are safety nets. But in reality, it's like our community should be our safety net, from my perspective. And we've just gotten our bunch of humanity sucked out of us because the government has taken over some of the things that we should be doing as a community. It's like, we want to reestablish that in healthcare so that you're actually connected to people in your community. So it's a big part of what we're about.
Do you see Bitcoin as a core layer to that piece? Because it allows people to, one, opt into a monetary system that immediately connects them with everyone else who's using it. So
yeah,
they're, you are kind of like creating that community immediately through Bitcoin, but then you can kind of layer in the crowd health aspect of it, this idea of like decentralizing health insurance and creating alternative solutions around the incentives that currently exist. So it's like, does Bitcoin play a core part of what you guys are thinking about for the future?
Man, I think it does. I think, food and health and the monetary system are so interconnected. I've talked about this a little bit on other podcasts. I'm still trying to figure out how to eloquently say this, but it's just like, one impacts the other, which impacts the other. It's just like this circle. And so I think one of the big problems with health insurance, and Jimmy Song, who if you're a Bitcoiner, Jimmy, he orange pilled me, and he's like, look, you got this big pool of money sitting at insurance companies that with the inflation that we're seeing is just melting, right? It's melting over time. And so, and so they have to jack up the rates because they have to, compensate for, a declining asset value. And it's like, but what if that asset value could not only be decentralized, right? Like you own that, but also in Bitcoin, which from my perspective over kind of any intermediate term is a better asset to hold than cash. And so can you, kind of upset this inflationary environment that I think is going to be, a multi-year issue with Bitcoin. And I was like, I think it will. I mean, I think it's a core component. I'm a part of the Bitcoin community. So you're sharing my healthcare expenses if you're a part of the Bitcoin community. And by the way, like if that Bitcoin goes from, what are we at now? 20,000. I'm looking at my block clock here. It's not there, but it's like we're at 20,000. If that goes from 20,000 up to 100,000, which I think we all think it will, like you own that, right? That Bitcoin is yours. You own all the upside. a health insurance plan, they have this big pool of capital, they get interest on it. That's theirs. They take that, not the community. Right. So it's like, I want you to own that upside. And if you leave Crowd Health, you take all that Bitcoin with you. It's yours. It's not mine. The account says your name on it, not Crowd Health. So like, I think that's just a key difference between us and health insurance. And I think it actually, I mean, if Bitcoin does what we think it's going to do, what I think it's going to do, I don't think I'm gonna have to ever pay for healthcare again. Like, because I'm stacking sats here on the side that's increasing in value. I don't think I'm gonna have to pay for healthcare again if it does what I think it's going to do, which is kind of cool. Like that's a cool long-term, low time preference approach to this.
Yeah, and it's like the ethos is really just around this idea. You said the word ownership. It's like through and through the entire stack. You're kind of just taking more ownership of every step of what it means to be a healthy person. And then you have this backdrop of a community where you're also able to take ownership in the pool of funds in some sense of what could be future healthcare costs. It's really cool.
Well, it's this group of people, and I know this is not a Bitcoin podcast, but there's a lot of overlap I've heard. Is like, there's this, I'm new to Bitcoin, only kind of a couple years in, but like there's this interesting, like, I want to be a sovereign individual, right? Mm-hmm. For my first time I heard it, I'm kind of like, ooh, I don't know. Like, I believe in a higher being that has some sovereignty and things like here. I'm trying to figure this out, but like, it is the most like community focused group of people that I think I've ever met. Like, yeah, you are sovereign individuals, but you operate within a community, and it's not about self, it's about serving others. But I want to do that in a way that, like, I'm not forced to serve others. Like, I'm doing it because I want to do it. I'm not doing it because the government says take care of poor people, right? I'm doing it because, like, there's an innate desire for me to care for other people in my communities. And like, I think Bitcoiners have that. Like, there's something there that's like, I want to care for other people in a way that I haven't seen from many other communities. And so I think it's a super cool community to be a part of. So a part of why we're doing it at Crowd Health is because it makes sense. A part of it is just because I love Bitcoin. So I'm going to do it, and I'm the owner. So
Andy, do you have a sense of just in terms of Crowd Health members, the percentage of members that are Bitcoiners versus non-Bitcoiners? Do you have that data?
Yeah, it's about 50-50 right now.
Oh, cool.
It's 50-50, I would say, but probably it's like 75% libertarian. So, and a part of it that I don't know is like we advertise on like Dave Smith and Tom Woods and some of these kind of libertarian, Michael Malice, libertarian or even farther kind of off, anarchist kind of groups. Like, I don't know if they're Bitcoiners or not, but they kind of come to us through those channels. And so I just don't know. But it's about 50-50 on Bitcoin, but a lot of libertarians.
How do you think about, taking a step back and looking at how Crowd Health fits into this whole massive picture of kind of health insurance? I don't know if that's what you would appropriately call what you guys are doing at Crowd Health, but how do you guys see yourself fitting in the long term? Just, projecting out the next 5-10 years of what's going to happen here in the healthcare industry in the US?
Yeah, so we're definitely not health insurance. So, that's one of the things that people have to understand. When you come to Crowd Health, you are uninsured. And so, we consider ourselves delightfully uninsured because insurance has been, again, we're being programmed to think you have to have insurance. And I'm trying to say, no, I actually may be one of the few people in this country who's like, more people should be uninsured because it's the insurance that are creating the inefficiencies, and we can do this in a better way. And so, I think as we get more and more people, we have thousands of people on Crowd Health right now, and I hope to have hundreds of thousands of people over the next few years in Crowd Health. And I think that we will start to see the healthcare cost curve bend to the better as a result of people actually, having an incentive to reduce cost, having an incentive to negotiate. And so, I think we can, revolutionize the way that we pay for healthcare in this country, and maybe even the world. I'm looking at literally working with a guy looking at Argentina, Venezuela, some of these, communities that have wicked high inflation and are getting crappy healthcare as a result of that. Like, how can we use Bitcoin plus Crowd Health to satisfy some of their needs? And so I think this could be a worldwide thing.
Are there any countries, Andy, or maybe communities that you think are doing things the right way, that have in some sense maybe served as like an inspiration or a model for what you guys are doing in Crowd Health?
Man, I know this is going to sound super weird, but I was at the the Bitcoin conference a couple years ago, and I was telling this guy what I was doing, and he's like, you know what? They do the exact same thing in Kenya. He's like, there is large communities of people, tens of thousands of people who will directly share expenses with each other, as opposed to going through health insurance companies, because they just don't have kind of the capacity to do health insurance in Kenya. And he says it's incredibly effective because people know that if I act in a bad way, there's moral hazard here, right? Like if I act in a bad way, it's going to impact the guy down the street, right? And I care about the guy down the street. And he's like, that's the way that it's working in many communities, big communities, tens of thousands of people in Kenya, of all places. Other than that, you're seeing more and more state sponsorship across the world, and I don't think state sponsorship is the right way of doing this. We can argue until we're blue in the face around it, but I fundamentally just don't feel like government should be involved in my healthcare decisions. I mean, that's just, I'm a hill I'll die on. I don't, even if it's to reduce cost, like I prefer to pay more, but have ownership, sovereignty over my own healthcare.
Have you always been that way, or did that come more apparent after the past few years? Obviously with everything going on with the pandemic.
Yeah, I think it's been since being like, probably married and having kids and some of these things. Like I see more and more, and as I make more money, as I get older, like more and more, like the government intervention in what we're doing creates massive inefficiencies. And I just don't want that for my kids. Like I want my kids to have like a great healthcare system that they can go to whatever doctor they want, and they are not under this socialized medicine thing where if I tear my ACL, it takes 6 months to go and see a doctor, and at that point it's all kinds of other things are screwed up. Like I just don't want that for my kids. So yeah, I mean, I think parenting and getting a little bit older and making a little bit more money and seeing more of my dollars going out of taxes and kind of looking at the world and through the pandemic and be like, we are not being told things that are accurate. We are being told things that clearly people have motivations, incentives, perverse incentives to tell us. And that just doesn't feel right to me. So, maybe become a little more curious about some of the things that people are telling me. By the way, I in one of these labs that I got, like I have wicked high LDL cholesterol. If I know, I mean, and it's what I find out is it has very little to do about food intake. So 85% of the cholesterol in your body is created by your body. And so very little of what you eat has to have a direct impact on your LDL levels. And from, what I'm reading is your LDL levels aren't actually the number one criteria you should be looking at this, for heart attack risk. I haven't had a heart attack in my entire family. My mom's 1 of 5, my dad's 1 of 5, and I'm 1 of 5, and nobody has had a heart attack. And all of us have high LDL, and all the other ones are taking statins. And I'm like, I'm not sure I want to take statins and put that crap in my body. But we've just been like, again, psyop to think like LDL equals statins, and these pharmaceutical companies are getting rich off this stuff. And, it has mental acuity issues and erectile dysfunction issues and all these things. I'm like, why would I do that? So anyway, it's like, we're being told things that just aren't true and are motivated by, profit and other things. It's just, it pisses me off.
I wonder if you might fall into the category of being one of those lean mass hyper responders. Have you done any digging there?
Yeah, I mean, I actually got I listened to a guy named Peter Attia. I don't know if you guys know Peter Attia. And it's like let's look at a couple other things. And so I actually got my LP(a) and ApoB yesterday. So I'm waiting for results of that. So I just maybe I'm one of those. But I'm 6'2", I'm 180. I'm like, I am by no means, fat. And so it's like, I don't understand what this is, but it's all genetics. Like a lot of people in my family have just high LDL. It's just a genetic thing. So question is, am I going to take statins on it? I'm leaning heavily against not doing that right now.
And go ahead, Brett.
No, I was going to say, it's an important point because we just have this strong focus to singularly we focus on this one variable, the LDL. Most people don't even know to look at their HDL to triglyceride ratio or even
Right.
just understand, their waist circumference being the single best predictor of their metabolic health or any of these other things. We just say, oh, LDL is too high. Okay, I immediately have to jump on a statin and just blanket
Right.
what my doctor is telling me, as opposed to maybe exploring some of these other options of what you're doing and saying, hey, does it actually make sense for me to take this when I'm 6'2", 180, I feel great, and all my other health markers are superb? Do I need to take a statin? Like, that's just important. And you don't hear that from healthcare companies. So it's interesting to see if we can kind of bake that into the ethos of Crowd Health and teaching people to be
totally
their own health.
Well, look, I mean, all of these primary care docs, right? They look to the American Heart Association or the American College of Cardiologists and say, oh, well, that's what they say, right? And these are big organizations that have been saying the same thing for decades. Right. And so it's really difficult for big organizations to say, hey, I'm wrong, and what I've been saying for the last 3 or 4 decades or whatever, 6 decades is just wrong, right? That's just a hard thing culturally to do within a large organization. And I think people like me that, have high LDLs, but low APOBs and low LPA, like I would normally have been on a statin, but I'm not going to go on a statin because I actually know more. So I think some of these big organizations are misleading us. And I don't know if there's perverse incentives there or if it's just human nature of like, it's hard to say you're wrong, right? Like it's hard, especially if you've been saying something as dogma for the last, multiple decades.
Yeah. I think the thing that I find at least hopeful in that whole line of conversation is that a lot of people are becoming a little bit more skeptical and able to see like the system as a whole is clearly creating a population of less and less healthy people each year. So we can kind of objectively look at the system in just through that lens. It's like, okay, something's not working here. We need to figure out some alternatives, at least to the current operating model of just looking at numbers and trying to diagnose based on numbers.
Yeah. Well, I love it that, it's guys like you who are looking at this and be like, let's actually be curious about this and actually let's dig in and let's get to the truth here, as opposed to just being fed, the information that we're being fed without asking the questions, which is, I love that about this kind of group of folks who are into high protein diets and just asking lots of questions. Again, like back to Bitcoin a little bit, like that's that group too. It's like, let's ask the questions, as opposed to just believing everything that people tell us. So part of taking personal responsibility, right?
Yeah, absolutely.
And to that point, Andy, when you think about just the future of society, our healthcare system, et cetera, are you an optimistic person thinking about that?
Yeah, I am. I am. I think if people have options, then they will, and see people like us who are saying, hey, I can thrive. All of us just innately want to thrive, right? We want to take care of our families. We want to feel good. We want to, and if they start seeing people taking a different approach and thriving, then, I think I'm optimistic that people will change their behavior. It's just, they don't have any other options right now. Like you can go do health insurance, and health insurance creates a bunch of perverse incentives that, won't make you thrive, but you don't have any option. Like at least you have an option now. So I'm optimistic. I'm not optimistic kind of about our political future, and that is so intertwined into a lot of this stuff. But if government would start taking themselves out of these decisions and let the free market and individuals make decisions on their own, I think we'd be way better off.
Yeah, it's cool. It's cool to hear you say that, because it feels like optimism can be, it's kind of a choice at times. Like, and right now it's like we need to choose to be optimistic about the future to build this world that can actually like coexist while this other world is really struggling, to be healthy, to all the things we've already talked about. It's like, we do need to like choose to be optimistic and just start building the future that we want in a lot of ways.
Yeah, it's a David versus Goliath, and it's like you read the story in the Bible or you read the book by Malcolm Gladwell, right? Like go either way, and it's like it's hard not to be kind of optimistic that the little guy can take out the big guy, and this Crowd Health is trying to take out UHC, which is like the 7th largest company in the planet, in terms of revenue. And so it's a part of me is kind of like, hey, it's fun to try to take down the Goliath, and in the same way, I think do very good things to our community. So would let it, any of your listeners would love for y'all to join us in kind of the mission to do this, because we're going to need a lot of people to kind of, knock over the apple cart, as they say.
Well, we appreciate it, man. It's been so helpful, just like learning a little bit more about your origin story. I didn't know everything that went into your background, so that's incredibly helpful. Just to appreciate the mission behind Crowd Health and everything that you guys are doing. I mean, you guys have generously agreed to sponsor our show, which we think speaks to the overall mission that you guys have to improve people's health, because we're really digging into that, that form of alternative medicine and trying to teach people about their dietary choices, like you mentioned, and leading into animal products, and, teach them how to be the CEO of their own health. So I think, it just means a lot to us that you're willing to do that, and just really excited as we all like combine this collective force, what we can do. So, just appreciate everything you're doing, man. And would love to have you back on for a round 2 in the future.
Yeah, I'll keep you posted on how this is going. And like I said, man, we're a bunch of group of people who are just on a mission to change this. This is not about dollars and cents for us. I did okay in the first round. I could go fishing, for the rest of my life if I wanted to. This is like, we want people to join us to like change the way that we do this, right? And if you're like fired up about changing the way that we get our healthcare, then come and join us, and DM me on Twitter or whatever, and I'm happy to answer any follow-up questions, or I can hook you up with somebody internally who can answer any questions about how we work.
Amen, man. That was well said, and just appreciate everything you shared on the show today. And we'll definitely link to all those social platforms that you have, so people can have easy access to Crowd Health and you and everything you guys are doing. But thanks so much for your time. This is great.
Yeah, thanks guys. Thanks for everything y'all are doing. I appreciate it.